Well, I would first of all wish to continue the programs that we had instituted primarily because of the economic devastation that the restrictions of COVID-19 had caused. And the burden that our people had to bear because of these restrictions and the loss and the resulting loss of livelihoods. So we will continue the Sugbusog program, for which I am working with the Vice Governor and all of our board members in evaluating from the municipal to the district to the provincial levels the best households, puroks, barangays, and local government units. I believe that next month in August we will be awarding the winners of Sugbusog Part 3. We will continue with the Sugbo Negosyo, which I have also been working with the active cooperation of the Vice Governor and the board members. The Sugbo Negosyo Season 1 was a resounding success. And so Season 2 will soon begin. That should benefit thousands again of beneficiaries, where they will be able to jumpstart their micro enterprises with financial assistance from the province through the Sugbo Negosyo cards. We will also continue, as we have started, the Sugbo Kahanas. That's 100 million. By the way, for Sugbo Negosyo, we initially already released 100 million. Sugbo Negosyo Season 1, that's another 100 million for Sugbo Negosyo Season 2. For Sugbo Kahanas, we have started to release part of the 100 million that we have also set aside for the training of our youth who wish to be able to be given short-term courses on welding, carpentry, baking, pastry making, dressmaking through the TVIs accredited by TESDA. And again, this 100 million, as I have done with Sugbo Negosyo, we have distributed to our 17 board members at 5 million per board member and 15 million for our Vice Governor. We hope that this term will finally see the end of the COVID pandemic, that we may bring our lives back to normal, not even new normal, mag-normal na ta. We have been abnormal for too long. Now, syaro naman po. Sa kadaghan ng vaccinated, magsige gyapon tag-insister. I mean, wa pa gyapon ni sila mahuman silang negosyo. Wa pa mahurot o kahalin ang mask. Hapit na mo expire ang RT-PCR test. Kung mauna man lang na, we will still continue with the same restricted lifestyle that has brought us to abnormalcy, in spite of having spent billions on vaccines, then what was it all for? Shall we continue buying masks? Shall we continue subjecting ourselves to expensive RT-PCR tests? Or naay mas barato pero mo gihapon tag 200, 300, and what I hear, ang mga maestra in town tag 900 ang bayran anang rapid antigen test. Padayunon ta na. Daghang pag-stock. Wa pa mahurot og kahalin. Maybe I should ask the manufacturers, undang na mo. Kaganan siya napita mo dagko. I would wish that we reclaim our normalcy and our humanity. That we remember that after all, we are social beings. We are not to be confined in our own isolated quarantine rooms, afraid that even though you show no symptoms, because the RT-PCR machine says you're positive, you're sick. Kanya magsugod ay contact tracing na po. Dahil na po diretso. You know, the surest way to increase the number of cases, go on indiscriminate testing again. So that even if you have no symptoms, testingan. Now, I would wish to remind everyone I believe that was the last DOH regulation that we have adopted here. Test only if you have symptoms. Di lang kay tungod kay nito imong ilong kunya niatsing ka symptom na na. Tungod kay samot na po. Tungod kay na crash kas motor symptom na na. Di na. Test only if you have symptoms, and it's very specific. Only after you have running nose, cough, and fever that has run for, I think, 3 days. Nya nalimtan naman na. Why? Kaya sige wag indiscriminate testing. Nya inig-adtos machine mo, ingon ra ba dayon? May sakit ka, maski wa kay symptoms. And then, media picks it up. Wow, it makes for good headlines again. Surge! Nag-surge, I'd love to know. Aning pila ni katawsan ilang giihap? Pila ka percent ang way symptoms? Pila man ang asymptomatic? Kung na kay tuberculosis, they do not call you asymptomatic as tuberculosis. Ana na kay inon, tibihon ka kung nagkaga-kaga na naghagalhal na imong ubo. Unya, nagluwa na kagdugo. Naabagoy asymptomatic tuberculosis. Naabagoy asymptomatic kurikong. Ana ra man kay inon nasakit na kagkurikong kay nagbutoy-butoy na kadiha. Naabagoy asymptomatic sa uban nga klase nga mga sakit. Kinira, COVID. Kanya mangita ka sa asymptomatic, kay aron musaka ang kaso. That's why you really need to re-evaluate how this has been handled. And I really praise the President for saying that in his inaugural speech, the deficiencies of the COVID-19 response have to be addressed. Because at times, you wonder, where did the common sense go? Where did logic go? It seemed that these have been set aside. For what interest? For whose interest? And this is also, sa paniya, this is the only disease that carries over the numbers from 2020 to 2021. How come ang uban mga sakit? Wala, may carry over. They give you, okay, for the year 2020, mauni kadaghan ang GTB. For year 2021, mauni. Pero for COVID, no. Since 2020 to 2021, syempre, moabot na kag millions. Unya, in spite of that, with their daily bulletin sa una, ang asymptomatic or mild, 94 to 95%. Unsay buti pa sabot? 5% ra ang moderate to severe. Kaning uban, mild or worse, asymptomatic, walay symptoms, pero giihap, apil na sa ihap. So, mao na po niya ako nakitaan ron, nagto sa Metro Manila, surge ko no, well, I would just be interested, yun sa kanila no, nagsugod po sila testing because I will not allow it here. Yang ano mang testing, man tabuhay mga symptoms, kay para sa COVID, kidaghan patag RT-PCR, hapit na mo expire. It's time for us to go back to our senses and our sensibilities for the poor and the downtrodden. Kaya ang labaw ni ining nagbaguod ang mga pobre. Bisan ka na pagsulog lagmasa, ikabutang giingon, magbaktas ka diha sa daan, di sa may madakpan kung ipadakop na nimo. Katuin taong nagbaktas, kaya wa may ipliti. Katuin taong nagbisikleta, unya nagmas pa gyud. Pwerte na nimo paningkamot o tindak diha. Unya magmas pa gyud ka, unya init kaayo. Kaya di man na madakpan ang mga dunay mga kotse. Sulod sa ilang air condition ng mga kotse. Ang katuin taong mga pobre. Maroon tayo madaog-daog. Kaya nga naman, di man kareklamo, di man katingog, wa may puder. And I find that so unfair. May man mo, mga dato man mo, mga laisyo man mo. Di mo maapektahan sa pag-stay at home mo. Kada adlaw kay daghang kay nindot ni series karon sa Netflix.